don't you go first?
Thank you, Cindy. Sure. I'm Marjory Bancroft, founder and director of Cross-Cultural Communications. We're the only national training agency for community and medical interpreting. And we are passionate about the training and education side, but also the topic of this community conversation.
That's it? That's all you're going to say?
Based in Maryland. Yes, remember she told us.
Brief.
Okay. They
Hi,
can read my bio.
Yes, that's right. Go ahead. You can all read our bios. I'm Cindy
It's not
Rote.
about me.
I'm Cindy Rote. I am a consultant and trainer around language access in healthcare. So I train interpreters, I train providers, I work with hospital administrators to try and improve their language access programs. My great claim to fame is that I've been around longer than almost everybody, so I'm just old.
Don't listen to her. I'm older than she is.
And yes, as people who know me will attest, training and moving from simply having a warm body in a room to call themselves an interpreter to having actually qualified, trained, skilled interpreters has been my passion for many, many decades. And it's great to see these changes happening and watch the development of this field. So, Will.
And I'm Will Hester. I am chair of world languages at Hillwood High School in Nashville, Tennessee. And I also serve Siloam Health, which is a nonprofit clinic serving immigrants, refugees, and asylees in the Middle Tennessee area, where I both interpret and I train and support a mix of professional and volunteer interpreters there. And I was lucky enough to be part of the EtoE study and test development process as a subject matter expert, since my background spans both education and linguistics. And so I was really fortunate to be a part of that and enjoyed it very much. And I think we should jump into our first question, which I'll pose to my esteemed colleagues, which was this approach that CCHI has been researching the possibility of testing interpreting skills in an English-only modality. It is to say, testing what makes us able to serve effectively as interpreters while doing all of that entirely in English instead of back and forth between English and a target language. What was your reaction to that? And how do you believe that the development of this assessment will support and benefit our profession and our interpreters?
Cindy?
Well, maybe I'll start out with that. You know, this is something that Washington State has actually been doing since the maybe late 1990s. We started out having a certification program for healthcare interpreters around 1995. And of course, it was only for the top 7 languages among the Medicaid population, because the justification was that Medicaid was paying for the interpreting. The state was paying for the interpreter for patients who were on Medicaid. And of course, then many people got very upset because it didn't cover their languages. And many providers became upset because they had no way of qualifying the interpreters that they were using. And the courts became upset because they were not in compliance with their consent decree. So the state moved into trying to find a way to test all the other languages. And they actually did it through an interesting method where the target language was, the non-English target language was never tested at all. And I think that it was the first attempt to try to do this. So when CCHI started discussing, when Italia started discussing, you know, how could we do something on a national level that would allow us to certify speakers of languages that aren't quite as common as Spanish and, you know, Russian in this country, I thought this was a great idea. And the idea that there would be some science behind it was extremely exciting, because what was done in Washington State was not really tested, as far as I know, stringently from a scientific basis. So this was very exciting, that there might actually be a way of testing other languages that wasn't as expensive as developing a language-specific test. Really exciting stuff.
Right. Well, I laughed when I heard that was going to be the first question, because I can still remember vividly what I felt. I was at a CHIA conference several years ago, and both Natalia and then chair of CCHI, Margarita Becker, buttonholed me basically and said, Marjorie, we want you to know something big coming up, a project that we plan. And they kind of laid it out very quickly. And I'm going, come over here, we have to talk, because I have a BA and a master's in linguistics. I'm a PhD dropout in Arabic linguistics. I still read research literature in that and primary medical studies. And, this sounded very ambitious to me. And I didn't know if this was something CCHI could pull off. Well, it didn't matter what tough questions I threw at the two of them. They had answers upon answers. And one of those answers that I drilled them on a great deal was the whole research study that, the EtoE study that we're talking about today. And I, instead of being skeptical, I walked away so excited. And I felt, and I feel to this day, that this is not only the most important research project and general project in the credentialing of interpreters that I've seen in more than a decade in this country, but frankly, in any country that I'm aware of in the world. So excited, that's how I felt. And I feel that the contributions to all the interpreters of all the languages who will never have an oral certification exam, because, if you put all the language pairs together and the cost, the odds are zero. Well, this is not an oral certification exam, but it is potentially a really valuable credential that will help people distinguished from a bilingual individual and someone who is perhaps skilled enough and qualified enough to interpret. So that sums me up.
And if
your turn, Will.
If I can build on that, I mean, we talk a lot, and I think we talk in important terms about the difference between the bilingual individual and the qualified interpreter, particularly in the healthcare setting. I mean, I believe it was you, Marjorie, that said during our little pre-talk that part of why we are testing folks over ethics and standards and medical terminology is because the stakes of our encounters are life and death.
Absolutely.
And so to have something that not only we've made a choice as an organization for folks that work in languages of lesser diffusion to test them over the ethics and the practices of the US healthcare system to provide a backstop there. But if we can also provide to them universally, regardless of their working language or working languages, if we can provide them with a way to prove that they can do some of what it takes to be an interpreter, that not only strengthens, they're going to prepare for this exam and strengthen their skills and shape their preparation around it. It will then influence the types of programs that are offered to help people prepare. And then it will ultimately shape how those interpreters are held in higher and higher regard by the organizations that employ them. It moves us towards professionalism. And that is,
absolutely.
We all know we could spend the rest of the half hour talking about the problems we have as a group around not being considered professionals. We're not going to go there. But we can reduce that. We can ameliorate that by creating and sustaining this type of test. It's huge.
Which could lead to higher pay, which would in turn generate the increasing levels of professionalism and education and training and credentialing, everything. I couldn't agree more.
Absolutely. I'd like to point out before we go to the second question, folks are posing questions in the chat. We may not be able to get to any or many or all of those questions in the chat. We hope that you'll be able to follow up through CCHI with any specific questions that you may need answers for. We can certainly help in connecting you to the appropriate folks there who may be able to provide some guidance. The next question on our protocol is, what are your thoughts about the development process of the EtoE test, and how do you feel that it will differ from simply a bilingual performance assessment? So the type of assessment we currently give in Spanish and other languages that we provide in CCHI, I don't have the list of those memorized. And how do you feel that it will continue to add value?
Do you want to start this one, Marjory?
Sure, happy to. First of all, the whole idea of beginning with this massive research study, I just applaud CCH for that, because without it, we have really nothing. We're just speculating in the dark. And they did it with a level of rigor. I'm not an academic, but I really did look closely at that all the way along. And it seemed to me that they checked off lots and lots of boxes. And when it came to what they are calling, or you're calling, bilingual performance, and I assume you mean language proficiency testing, I could see when they talked about it, and also when you talk in the research, including the report on the research, also about the whole testing process. This was done from top to bottom by people who cared about doing it right. And to help people understand, taking a language proficiency test to show that you are bilingual in English and the other language that you interpret in this country, or other languages, only shows that you are linguistically capable of and ready for the training and education to prepare you to become qualified. It doesn't say that you're actually skilled enough to interpret from one language to another. And we deal with that every day, that question every day. That's why somebody who is bilingual isn't an interpreter automatically. Well, this test is, since we don't have an oral certification exam for most questions, we are definitely facing a possible credential that is actually looking at skills by breaking down the skills that are needed to interpret and testing those, or a certain number of those skills, as a proxy for the oral certification exam we can't have. So it'll never be the same as oral certification. I mean, you know, an oral certification exam, and CCHI is transparent about that, but it is something meaningful that focus on the skills, not being bilingual, but the skills that are needed to interpret. And that for me is the main value, if that answers your question.
Yeah, I would say the same. You know, there's various ways of establishing validity for a test. Validity means the test tests what it says it's going to test, right? And so one way of testing, you know, validity is to do a survey of what people are required to do, and then show that the test actually tests the same things. Now, obviously, this test isn't valid in that sense. People aren't being asked to interpret, right? But there's a second way of establishing validity, and that is to show that the test that you're giving correlates highly with another established method of testing those things.
Cindy, can I put in, you may be describing the difference between construct validity and predictive validity. Construct validity meaning that the test is going to specifically measure something you do. Predictive validity meaning if we test this set of things, it will predict how good you are at this other set of things that we happened not to be testing.
And in this case, I think that's what this is showing, is that the results, although to be honest, you know, we could have hoped that the correlation was a little higher than it was, you know, but on the other hand, it's really hard to get people to do this kind of testing in the middle of a pandemic when all the testing centers are closed down. But I think it has shown that this kind of EtoE testing does have value in predicting how well people are going to do as interpreters, specifically for, not specifically, but more, how can I say that? And we got a higher predictive value for languages for interpreters who were native speakers of the non-English language.
Yes.
Now, being a native speaker of English as an interpreter, I can affirm that we are in the vast minority, and that most of the interpreters doing community interpreting out there their native language is the non-English language. So that's correct. Good news for the test. That means the test is more valid, is that we can claim a higher level of the predictive validity. And I think that is really exciting. And as Marjory so well said, I think the science in this is unassailable. They did a fantastic job of
Absolutely
using all the best science in the field to do this kind of test. And it took a long time, as you guys know, and it cost money.
A
And
lot
they
of
had to go get
money.
funding. But as a result, I don't think we can turn around and say, oh, well, you know, but we're not sure if the actual study was valid. That the study was really well done.
Yes.
I'd like to echo what Cindy is saying about the fact that when you break down by subgroups that non-English dominant folks, that for non-English dominant folks, it demonstrated greater validity is really important, not only because non-English dominant individuals are the majority of our community interpreters in the United States, but because the test being given in English, if it had been designed poorly, it would have almost certainly disadvantaged non-native English speakers.
Great point.
If you've ever
Very good
taken
point.
a test
Good point.
and you're not, those of us that studied abroad, right? They did a whole semester. I did a whole semester in Spain. I had to take tests in Spanish. I would have done a lot better had they been in English over the same material. So the fact that our non-English dominant folks in the aggregate, now, some of those non-English dominant folks speak better English than I do, but in the aggregate, if the test had been poorly designed, we would have seen them do worse. And we did not see that. We saw the opposite. It is excellent evidence that the test is good, that it's got predictive validity, and that it's measuring reliably what we want it to measure. Hi, Natalia.
Hello. You see, that's what the beauty of community conversation is. You may drop out, but the community is still there. And they
Yes.
We were just about to get to the third and final question, which I think is great since we're down to about 5 minutes. Natalia, would you like to ask question 3, or shall I pose it as I've posed the other 2?
Go ahead, please.
So the last of our 3 major questions is, what do you see as the challenges that may arise when adopting this new credential? And my favorite half of this question, what can we do or recommend to support the adoption of this credential and moving towards a future of interpreter training and interpreter support where this type of credential is an important part of what we do?
Go ahead, Cindy.
You know, I sound like a broken record. People who know me are going to be so sick of hearing this, but training. You know, as we moved towards certification, a group of interpreters kind of got pushed forward really quickly. But, you know, the more work I do in the field, the more worried I get about the fact that I think our vast majority of the people doing community interpreting in this country still are not getting any training at all. I know we're kind of worried about pushing people, you know, way up here, but we still got this huge group of interpreters down here that are getting no training. Not, you know, it's not the training to pass a national certification exam. It's like nothing.
And one day.
Yeah, and I really worry about that. And as we start looking more at languages of lesser diffusion, or languages of lower incidence, which is, you know, lesser incidence, which is what's in the report, you know, those languages that there aren't a big population in the United States, so these interpreters aren't working as much. The cost to them of getting basic training gets incrementally higher because they're not making this money back. And the time that they need to invest in it is a problem because, you know, they're not spending that much time interpreting. They can't make a living at it. To some degree, going virtual has been some degree of help because people can work, you know, in a national ambiance instead of just whatever population is local. But still, I think we as a profession need to pay more attention with supporting, not just requiring, but really supporting these people in getting basic training for everybody. And to some degree, in my mind, this means not just suddenly requiring a credential of everybody, but it means saying, okay, as states, maybe, let's start by saying, okay, you know, next year, everyone has to register. If you're going to interpret, you've got to be on a state registry. That just means you send in $25 in your name and your information. And then the next year after that, or maybe 2 years after that, we're going to require all those people to have at least 40 hours of training to get a license to interpret. And then maybe a year after that, we're going to require people to start to have certification. But to make it an incremental working up towards this. And, you know, I know that doesn't make you probably very happy, Natalia, because what? Oh, we're not going to do this for another 4 years. Not going to be required. But I think if we require credentials that are so far out of people's reach that it's unrealistic, we just widen the gap between the credentialed, the professional credentialed interpreters and the supposedly unprofessional, uncredentialed interpreters. My thoughts.
Agreed to everything that Cindy just said. For me, one of the first challenges, Will and Natalia, I'll be honest, is trying to get people in this country and anywhere else to understand what the EtoE exam is all about and why it matters and how it works and what it measures and the meaning of what it measures. So that's one challenge. And another challenge is, and piggybacking on what Cindy said about training, as someone running a training agency for 21 years, what we see in the field of community largely, and community interpreting largely, including healthcare interpreting, is, as I was mentioning in the chat before this meeting, we're not actually training a lot of the skill set. It's more, we're training the decision making around ethics and best practices and standards and so forth, situational decision making, but actual linguistic decision making and the skill set, not so much. So to the degree to which the EtoE exam raises awareness of what component skills are and how they actually contribute to being able to interpret from one language to another and back, that, to the degree to which I have been kind of obsessed for the last couple of years with bringing it into our own programs. We have almost 400 licensed trainers, so we have a kind of outsized impact on training in this field, both medical and other areas of community interpreting. It's like, it's a kind of big responsibility. But it dovetails with EtoE because that's really true. It's not an oral certification exam, but it's measuring skills that are needed to interpret. So it's an exciting moment, I think, in the history of the field.
I just want to add two really quick things because I know we're short on time. One of the things is that in each community in the United States, in each state, in each city, there are linguistic groups that vary in size. When you work in Chicago, there will probably be a Polish interpreter. When you work in Middle Tennessee, there will probably be an Arabic interpreter. And that varies from place, but Spanish in almost every place has that critical mass. But then in every place that we are trying to live into our social value of providing equal access to the healthcare system to everyone in this country, there will always be folks who need these services in languages of lesser diffusion. And so I believe that EtoE is important because it allows people who support, who hire, who select, and who train, but also just frankly, who want to be there for those folks and to empower them to provide the service at the highest level. It gives us something, it will give us something to truly measure what they're able to do, so that it does not become, as somebody wisely pointed out in the chat, just, oh, Steve is bilingual, he'll do it, right? He speaks whatever this language is, he'll do it. We need this for that reason. And the second thing is, it really will continue also to help us understand how to move the profession forward, not only in terms of how we are hired and paid and valued, but how we train and educate the next generation of interpreters. It has been such a joy for me to get involved with CCHI and to be able to hear from the people who brought it all together and were there at the beginning of that enterprise. But each generation, each group, we want to make it better for the ones who come after. And this is a link in that chain. So for everybody who's out there today, to be a part of this by advocating for this exam and for pushing for why it matters, we can all be part of making things better and broader and more inclusive for those that'll come after us.
And I have to, just to finish up, I just want to say, and this is why the science that was put into this and the care with which the study was done is so important, because the very first criticism that's always going to come when people hear about EtoE is but you're not testing interpreting.
Right.
You know, and so now we have the results of this test to be able to say, well, yes, but we can show that this is a good proxy. Also, if I'm correct, and I believe it's never been the intention of CCHI that this should be all by itself the only criteria for getting a credential. So this is one criteria, and there's a language competency criteria. And I'm guessing, I'm not sure about this, there'll also be a training criteria. So, you know, I think that, you know, all together, this creates a credential that is something that we can really hang our hats on.
And I believe, just to close in a sentence, that this project, more than any other I've ever seen, has the potential to revolutionize, transform, and professionalize community interpreting around the world like no project I've ever seen.
Oh.
Good luck.
Can we just say too that I know this Vanessa, thank you, Vanessa, has put the study report link. I just want to say really quickly, the study report's really hard to read. Read the summary instead.
Read the summary. Yeah, read the summary.
The summary. Unless you are a testing professional, you will not understand the full report, which is as it should be, because it was written by professional you know, psychometricians. But read the summary. That's what you're going to understand, and that's what summarizes the key points.
The summary is the report translated into regular English.
Well, thank you very much. I mean, I'm so, you know, humbled. That's always how I feel after a conversations or project. I'm so humbled by the people around who are doing things that move our profession forward. And, you know, my personal journey here started with Cindy being my mentor as Train the Trainer for Bridging the Gap, Marjory being my mentor for cultural competence trainings. And then I met Bill during this project for the first time 2 years ago as a subject matter expert. And I'm always amazed how collectively we create valuable things. And I want to close also with a couple of words about the future of credentialing. You have talked about this project from the point of view of, you know, trainers, of interpreters, of our profession. And I want to bring in the part that we also contributing to is adding to how testing in general works, because a lot of tests are developed already based on a clear premise. Doctors do this, we're going to test this. Interpreters do this, we're going to have Spanish, English, Arabic English, Mandarin English exam. What we're trying to do with this new credential is to go at something that is not at this face value, right? Well, in engaging with English language, paraphrasing, understanding the nuances of meaning, these are all sub skills, as you have been pointing out through this conversation, but yet without them, you cannot really interpret. And so what we're trying to bring to this new type of testing is the credential, like Cindy just said, which has many components. And this exam is one component in showing that you have the sub skills to interpret. Then add to it language proficiency piece, which will be tailored differently to whether your native language is English, or it is Burmese, or it is Russian, or it is French, or it is Somali, right? And maybe we and hopefully collectively in 2022 we'll make this kind of decisions. Maybe we'll need some also follow-up of post-testing components, create a full portfolio, like, yes, this person had all these prerequisites, they passed the core CCHI exam, they passed the EtoE exam, and we followed up with some mentorship report that they actually are doing what's they are supposed to do. So that is the creative part of this project, and I hope you will be with us to implement it in 2022, 2023, and many other years to come. And I apologize for the technical issues that I've experienced on my computer, but I'm so happy that you picked up and made this event possible. So thank you, everyone. Thank you for joining us. Have a great holiday season, new year, and let's just support each other in all the things when we try to move forward as a profession. Thank you, everyone. Have a good afternoon.
Bye, everybody.
Bye.
Bye.